let's talk about anxiety, depression, what you're seeing in your office, what you're doing, formulations. Are you? Then we'll get into different cannabinoids, or you can talk about it now, what you do with a normal patient. And again, for our listeners, this isn't to replace a one-on-one with your medical professional. This is for informational and educational expert advice as well. But again, and not to replace a one-on-one with your own personal physician.
Good.
Disclaimer. I had to throw the disclaimer in there.
No, I think that's a good disclaimer because I think, we're seeing this, in the internet age, everybody just kind of wants to Google the answer.
Yeah.
I think I'm not trying to put that down. I think, when I have an issue, I often turn to Google, but, for better or for worse, I have a little bit more of a framework when it comes at least to medical issues into which to fit that information and quite a healthy skepticism that I think we need to see more of when it comes to interpretation of the information that's out there. Where do we start with depression? Well, the first thing I would say is that, we really have to look at the diagnosis. It's awfully easy to say, I have depression or I have anxiety, but there are a number of conditions that can mimic those conditions that are, less psychological and more physiological, like hyperthyroidism, hypothyroidism, and there are a whole bunch of them. And so it again, sort of to your point about maybe it's not the very best idea to sort of DIY your healthcare. This is something you should check in with your regular doctor about, and kind of go through the checklist of what could be causing these problems before we sort of leap to that diagnosis. If, on the other hand, we've kind of ruled out some of these other kind of sneaky guys, and we're left with something that's more garden variety, then we can sort of start to talk about where cannabis fits in. I think cannabis as an antidepressant and as an anti-anxiety medication is useful and good and not super potent, right? I mean, meaning, I have patients who come to me and they're like, I have these symptoms of anxiety or depression, and they're bothering me now, but it hasn't been such a big deal that I'm not on any medications for it. And so, one might start them on a beginning dose of a medication like an SSRI, or you could start them on a beginning dose of cannabis. And as far as I look at it, I think that either of those approaches is reasonable for the treatment of these illnesses. And so it really comes down to sort of what is the patient comfortable with and which approach feels best to them. On the other hand, I have patients who come in and they say, look, I'm already on an SSRI and an SNRI. And so, they're on a constellation of medications that maybe haven't gotten us to where they want to be. And sometimes I hear people saying things like, and I really want to get off that medicine.
Yeah.
And, I have to kind of question the wisdom of viewing these things as the goal is to get off something that is otherwise kind of helping you. And I can also say that because cannabis isn't super potent for this indication, if you're on a series of antidepressants now, and it hasn't gotten you to where you want to be, then it's unlikely that cannabis is going to be a replacement for those medications. However, one of the things that we often see is that people who are on those medications may be getting some or most of the way there, but then they've got a bunch of side effects, right? And so side effects of common medications include sort of feeling like a zombie, which is what people talk about a lot, lots of sexual side effects. Sometimes there's weight gain, which is harder to deal with. But the point is that thankfully, cannabis actually plays really well in that sandbox. So it's not an either or proposition. If somebody comes in and they are on nothing, then maybe a little cannabis is all they need. But if somebody comes in on a kind of a good cocktail of medications, it may be that adding cannabis is all you need to sort of get, over the hump and into that sort of sweet spot, that happy place, whether that's by adding an additional amount of anti-anxiety or antidepressant, or maybe it's simply that the conventional medications are doing fine, except that they come with this baggage, and we can kind of undo some of that baggage by adding cannabis.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at Patients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.